In this presentation, I'm going to cover the topic of morning sickness. I know that this topic is of great interest to many women while they're pregnant. The good thing is that we can investigate a little bit and look at some options for maybe what can be causing morning sickness, and we can come up with some potential solutions. But like a lot of other things with nutrition and with pregnancy, there's a little bit of a trial and error aspect. So I can give you suggestions, and I can also give you tips on how to prevent morning sickness. So if you're not pregnant yet, you can start doing some of these things now before you get pregnant. But when it comes down to it, when you are pregnant and you're experiencing morning sickness, there are some things you can do, and there also may be some extent of it that is out of your control at that point. If you've ever experienced morning sickness, then I would guess that you'll feel that the potential solutions here are definitely worth a try. Unfortunately, we don't know exactly what causes morning sickness for sure. There are many theories about it. What we do know is that some people are practically debilitated fully by their morning sickness, and other people don't experience it at all. The theories about it are that it could potentially be related to a deficiency in vitamin B12 and B6. It could also be related to a deficiency in magnesium. It could be a result of low blood sugar or because of hormone changes that happen during pregnancy. And another theory is that it's your body protecting your baby from toxins. The bottom line, what it really is, we're not totally sure. But based on these theories, we can come up with some ideas of things you can do to prevent it and to potentially address it if you're experiencing it. So what can you do about morning sickness? Well, because we don't know exactly what's causing it, all we can do is come up with potential solutions that address those theories that I talked about on the last slide. If you're not pregnant yet, there's a few things you can do in a preventive effort. One thing is you can increase your magnesium intake. My recommendation is to do this through food. You can increase your B6 and B12 intake. Make sure to get adequate vitamin D and also take a multivitamin. If you're already pregnant and you're experiencing morning sickness, you can do the same things that are listed for women who are not pregnant, but you just want to get your doctor approval first. The other thing you can do, because one of the theories is related to blood sugar, is to make sure that you keep low sugar snacks by your bed and eat more often throughout the day. So eat small things throughout the day and make sure they're coming from low sugar sources. And so if it is a blood sugar issue, this will help you keep your blood sugar stable throughout the day. For the same purpose, you can focus on eating more protein and more fat, of good quality of course, and less sugar in general. On this slide, I'm going to share with you some other advice. So additional things you can try if you're experiencing morning sickness. I think the first one is my favorite. Take naps. The second thing on the list, don't move a lot after eating. This could possibly help to keep your stomach settled when there's food in it. The next piece of advice, get out of bed slowly in the morning and even consider eating a few bites of food before you get out of bed. So keep something bland and small, maybe on your nightstand, so that when you wake up in the morning you can take a few bites, wait a minute, and then get up. The next thing on the list, avoid caffeine and spicy foods. You can test these things out and see if it makes a difference. You could also try eating smaller portions more often throughout the day, which I sort of mentioned on the slide before. In relation to blood sugar, this could be helpful. The next piece of advice is to not spend so much time in front of the computer. The frequency of light that's coming off your computer monitor can actually contribute to feelings of nausea, especially if you're experiencing morning sickness. The next one is to consume ginger. Ginger is known for settling your stomach, so you could try and eat a small amount of ginger because it is a very potent root. The last piece of advice that you can try if you're experiencing morning sickness is to be physically active. You would do this at a low intensity. You may just walk around the block a couple different times throughout the day. This list also has some ideas for things you can try to address your morning sickness. You can do things like find calming scents that you like, chew gum, eat something salty, eat some bland carbs like maybe a couple saltines, and wear loose, comfy clothing. All of the advice that's here on these slides came from either doctors or from my clients who found things that worked for them or at least helped a little bit, and so I just put them all together in a list for you. I don't know what's going to work for you, but I know that morning sickness can be a really awful thing for you, especially during the first trimester for most people that experience it. And so I know that it's worth it to keep trying different things. Obviously, the best option is if you can start to address morning sickness before it even happens. So you can take that advice I gave you in the beginning of the presentation and lay the foundation for not having morning sickness. Now, I'm not really sure if it will work, but it's probably worth a try. And all of the things that I advised you might help. They're good for you anyway. So that's a good place to start. However, if you're already pregnant and you're already experiencing morning sickness, you'll probably need to do some experimenting. This isn't an exact science, but there are some ideas for you and things you can try to help your morning sickness. The best piece of advice I can give you is to look at the list of things you could try and try something that doesn't sound dreadful or nauseating. If you try that and it doesn't work, then, well, try something else. If that works, great. If it doesn't, try something else. So, unfortunately, you may be trying a lot of different things, and hopefully you will find one or more solutions that will help your morning sickness, if not get rid of it completely.